Okay. Good afternoon. Today we're with Dr. Wong here from the ENT Center. We just talked about the current medical situation about the Wuhan virus. Is there anything that people should know about it, or how to protect ourselves against that?
Okay, so in general, I think people need to know about the symptom. Okay, the cough is the main symptom.
Okay.
But from the medical point of view, there are different types of a cough.
Okay.
First category is what we call allergic cough.
Okay.
Allergic cough is very common. Sometimes in Hong Kong with the pollution or the change of weather, many people have cough, but they don't have any infective symptoms.
Okay.
They don't have any fever, they don't have any yellow or green sputum.
Okay.
They just feel itchy throat and coughing,
Okay.
and sometimes even disturb the sleep.
Okay.
So this type of cough normally firstly seen by a general doctor.
Okay.
If they cannot manage, usually the patient will be referred to a specialist.
Okay.
Second category of cough is what we call infective coughing.
Okay.
Infective coughing, by definition, the patient may have fever and also produce a lot of yellow, green, or yucky,
Okay.
flame.
Okay.
And now at this stage of the year in China, in Hong Kong, we are worried about the Wuhan
Yes.
pneumonia,
Yes.
or it could be caused by what we call a coronavirus. It's just one type out of hundreds different
Okay.
type of virus.
Okay.
Maybe is from the bat, but people are just speculating. However, the symptoms are usually much more serious. They may have high fever and more the severe symptom, muscle pain, or even coughing or dehydration or other symptoms. In that case, we need to be pretty alert.
Okay.
Otherwise it can spread to the community, and they may even need to be isolated in the hospital.
So this type of Wuhan virus is more infective.
And the most horrible thing, just like the SARS in 2003, if it's highly contagious, it can spread quickly into the community and cause a widespread outbreak.
Okay, so what's the best way to protect ourselves?
Well, even for medical personnel, every day we keep on washing our hands. We avoid touching our eyes and nose and mouth. And also we use the most useful prevention is the mask. Even when we do operation in the operating theater or walk in the ward in the hospital, we always wear masks. That's the best protection.
Okay, so for masks, is there any special mask you need to wear, or just off the counter?
Normally, the standard mask should be protective. I don't think you need to wear the N95. Usually, people cannot tolerate the choking sensation if you wear it for too long.
So normal mask is still okay for this virus.
Okay.
And as long as washing the hands and don't touch the face.
General hygiene, and don't go to crowded places. If people are coughing around you, quickly go away.
Alright. Yeah. I see. Okay, that's okay. And also so this kind of symptom is more effective. So it's more like a flu-like thing, or just if you have muscle pain, or you have yellow or green flame, then you better go see a specialist doctor first, and then get medication.
Sure, because from the patient's point of view, sometimes it's hard to distinguish. Sometimes the infection can be bacterial, which classically produce a lot of yellow or green sputum. In that case, antibiotics is the most useful drug. However, for other things like flu, you need to have the rapid test for flu. If it's really positive for influenza A or B, you may need something such as Tamiflu to treat the symptom immediately. For other viruses, there may not be any specific treatment.
So basically, if you have a normal cough, you can see a general doctor first.
If the cough is not too bad, see a general doctor first. Usually they can sort out what type of coughing it is. If they think they cannot manage, they either refer to a nose and throat doctor if they think the problem is actually coming from the upper airway, or they refer directly to a respiratory physician to see if it's something wrong with the chest, such as bronchitis or pneumonia.
So no need to be overly concerned about every cough for the symptom you have, unless you've been to Wuhan, right?
Sure.
So if not, just go see a normal doctor.
Yes,
and they can arrange if it needs a specialist.
Exactly.
Or just a normal cough.
Exactly.
Okay. That's all today, and we'll talk about more later. Okay. Thank you very much.